Hello there. Please sit, make yourself comfortable. Thank you so much for joining me for this stress assessment study. I really appreciate your participation. Can I interest you in some tea at all? I brought with me just a little bit. This is a caffeine-free chai tea with decaffeinated black tea, ginger, cinnamon, cardamom, black pepper, white pepper, clove, and nutmeg. The tea originates from India and China. Let you have a little smell. It's quite blustery out there, isn't it? Very, very windy. It smells lovely. Here, take a little smell. How is that? Okay. If you would like some, just let me know. I can brew up a cup real quick. It is a little spicy, of course, but 'tis the season, right? So if you'd like, we can just get started then. Very good. Now, I have a portable keyboard and a tablet for the purposes of our study. Let me just set this up. Good. There we are. So I'd like to just ask a very short couple of questions, okay? First, can I grab your name? Okay, and your date of birth. Good. And is that your preferred name, and how do you like to be addressed? Very good. Now let me see. Okay, so you already had filled out the medical history questionnaire prior to this, so we don't need to go through any of that. Now, before we get into the actual assessment, I would like to do just a preliminary baseline examination. I will be taking your vitals. I'll be looking at your eyes, your ears, nose, throat, lymph nodes, heart, lungs, abdomen, a little bit with your arms and hands, your legs and feet, just very cursory, but still very necessary. If that's okay with you? Okay, let me go ahead and sanitize my hands real quick. And for the purposes of this examination, I will need to be touching you. Is that all right with you? Do I have your permission to do that? Very good. Thank you. So let's just start by taking your temperature. Now if you could just open your mouth for me. Lift your tongue to the roof of your mouth. And allow me to just put this right underneath your tongue, and you can lay your tongue on top. And we'll wait just a few moments until we hear our thermometer beep. Very good. Let me just record that. And now your pulse and respiration rate, okay? Do you have any preference as to which wrist I take your pulse from? Okay, let's just do right here then. I'm just going to roll up your sleeve a little bit. And I'm just going to put my first two fingers right below the base of the thumb on the radial artery. And we are going to sit here for just a little bit while I grab your pulse and respirations. Okay, I'll just roll that back up. So, pulse was a little jumpy. Are you feeling nervous? Yes, I suppose it perhaps is a little nerve-wracking to sit in front of a stranger and get some tests done about your stress levels and also do a physical examination. I want to assure you that I have absolutely no judgment here. I am only using this information for academic purposes, and if anything makes you uncomfortable, please let me know. We can hang out for a little bit. I've still got some tea, and we can wait until the vibes feel a little bit better for you, okay? Okay, so let me just record those couple of numbers. Very good. And now we're going to take your blood pressure. So I have my sphygmomanometer here, as well as my stethoscope, and I'm going to be putting the stethoscope in first so that my hands are free. There we go. Okay. Now I'm just going to use this same arm that you allowed me to take your pulse with. So I am going to wrap the cuff around your arm. It will be quite firm, but this process does not take too long at all, okay? Okay, and I'm just going to press the diaphragm of my stethoscope into the crook of your elbow, the cubital fossa here. And I have the dial in one hand, and I'm just going to be inflating the cuff and measuring your blood pressure. All right, ready? I'm going to let the air deflate a little bit, and then we're going to do that just once more. Okay, closing up the valve. Okay. And releasing just going to take the cuff off. And set aside the stethoscope just for a bit. Good. Let me just note that down. Let's see. Very good. Okay. So upon general inspection of you, you look symmetrical. I'm not seeing any outward signs of illness or pain. You don't look to be injured at all. Your skin's the correct pallor. And you look pretty healthy. So I'm just going to take a little look firstly at your eyes. Just real quick. I'm going to take this little pen light here, and I'm just going to come up real close. And I'm just going to take a little peek here. Just a little peek. Okay. Have you had any problems with either your vision or any pain or discomfort with the eyes? No? Okay. Very good. Just want to look, make sure that all looks good. Good. Okay. Now let's go ahead and take a look at your nose. So I am going to grab a speculum for my otoscope. Just pop that on. So I am just going to be taking a little look up your nose. So if you could just tip your head back for me. This will not be going inside, but it helps concentrate the light into a smaller point so that I can see in your nose. Okay? Just tip back for me. Good. Okay. Very good. And you could go ahead and let your chin drop. And I'm just going to take off that speculum so that we won't be putting that in your ears or anywhere like that. Now with the speculum off, I am going to use the head of the otoscope to shine a light inside your mouth. If you could just open your mouth for me. Good. Okay. Any problems with your sense of taste or smell? Any pain in your nose, your mouth, or your sinuses? Okay, what about your teeth? And how about your throat? No. Okay. Give me just a moment here. And I'm just going to push your tongue down. Just like that. Good. Okay, and if you could say ah for me. Very good. And I'm just going to take a look at your throat now. It's a little red, but there's still a little bit of allergies going around, and the air's gotten a lot drier, hasn't it? But if you haven't had any pain, then that may just be something to keep an eye on, okay? All right, let's pop on a speculum and let's take a look at your ears. Again, I'm not looking necessarily to diagnose you with anything. I'm just making sure that you are in relatively good health, at least for the purposes of our study. Okay, so now I'm just going to take a little look in your ears, all right? Have you had any problems with your hearing at all? And what about ear pain, irritation, swelling, anything like that? No. Okay. other side. Okay. Just go back. Okay, I need to reach just a little bit here. Okay, so ear canal looks clear. No sign of any buildup of cerumen. And the tympanic membrane looks to be in good health and condition. And I think that that is just fine for this assessment. Okay. Let me take our speculum off. All right, let's go ahead and let's have a little look at your lymph nodes. So I'm just going to start at the back of your head and move to behind the ears, in front of the ears, going all the way down under the neck, or under the chin rather, and then into the neck, okay? All right, so you'll just feel me palpating along the back of the head here. And then just bringing that behind the ears. And then in front of the ears. Okay. And down. And then under the chin, the submental and submandibular nodes here. Good, and let's go down into the neck. Okay, we have the superficial cervical, we have the deep cervical chain, the post-cervical chain, and we have supraclavicular on top of the clavicle. Okay, and that all looks good, all right? Let me just go ahead and jot down some notes while we're ahead. Okay. Hear the wind rattle the windows? So let's grab our stethoscope. And we're just going to take a little listen to your heart and your lungs. So just keep breathing normally, and I'm just going to be listening all around your chest, okay? We're going to start by listening to your heart. Your heartbeat certainly calmed down a little bit. Okay, very good. And let's take a listen to your lungs. If you could just take a deep breath in for me. And out. Deep breath in. 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 And out. Good, good. Okay. Now, I'm I'm just going to be listening to your abdomen just over your shirt, okay? Normally we would do this under the shirt, but we're not necessarily trying to listen to the most minute of sounds. I just ask that you stay still for me. As long as I don't shift around. Doesn't impede too much. Okay. We're going to do just a little bit of palpation. Have you had any problems with your heart, lungs, or any of your digestional organs lately? I know that's pretty broad, but anything of note? No? Okay, I'm just going to be pressing on your abdomen, okay? You just let me know if it's tender or painful, okay? Alright, so I'm just going to do some firm pressure here. Anything out of the ordinary? No? Okay, that feels just fine. So if you wouldn't mind just showing me your hands real quick. Okay, very good. And I'm just going to check the capillary refill on your nails. Good. And if you could just turn them over for me. Okay, and back again. Temperature feels just fine. Looks good. Okay, and if you wouldn't mind just showing me your elbows real quick. Okay, you can go ahead and relax your arms. All right, looks great. Now I'm just going to take a look at your legs and your feet real quick. Nothing too special. Just want to check the capillary refill on the toenails. Okay. And I'm just going to real quick, we're going to do a little knee-jerk reflex test. So I want you to allow your legs to just dangle. Okay. All right, I'm just going to real quick check your knee-jerk reflex. Good. Good. Okay. All right, so go ahead and relax. It'll just take me a moment for my notes. Very good. So your examination part is complete, and now we can get into our assessment. So I'm just going to use my little stylus here, and I'm just going to pull up, there we go, our document. All right, so we are using a few different stress assessment scales today. So, firstly, symptoms of stress. How frequently do you find yourself experiencing such problems as headaches, problems going to sleep or staying asleep, unexplained muscle pain, jaw pain, uncontrolled anger, and frustration. So I am going to list off a symptom, and I want you to tell me if you experience it never, once a month, once a week, 2 to 3 times a week, every night or day, once or twice daily, or almost all day, every day. Okay? I'm just going to move my keyboard for a second. I can rest my elbow. Okay, so first symptom, headaches. Do you experience this never, once a month, once a week, 2 to 3 times per week, every night or day, once or twice daily, or almost all day, every day? Okay. And tense muscles, sore neck, and back. Do you experience this never, once a month, once a week, 2 to 3 times per week, every night or day, once or twice daily, or almost all day, every day? Okay. And what about fatigue? Okay. Anxiety, worry, or phobias? Okay. Difficulty falling asleep? Okay. Irritability? Insomnia? Bouts of anger/hostility? Boredom, depression? Eating too much or too little? And restlessness, itching, or tics? Okay. All right. So now we move on to the perceived stress scale. A more precise measure of personal stress can be determined by using a variety of instruments that have been designed to help measure individual stress levels. The first of these is called the perceived stress scale. Now, for each question, choose from the following alternatives: 0, never; 1, almost never; 2, sometimes; 3, fairly often; or 4, very often. I will give you the little prompts and I'll write the numbers for you. Question 1. In the last month, how often have you been upset because of something that happened unexpectedly? Never, almost never, sometimes, fairly often, or very often. Okay? In the last month, how often have you felt you were unable to control the important things in your life? Never, almost never, sometimes, fairly often, or very often. Okay? In the last month, how often have you felt nervous and stressed? Never, almost never, sometimes, fairly often, or very often. Okay. In the last month, how often have you felt confident about your ability to handle your personal problems? Okay. In the last month, how often have you felt that things were going your way? In the last month, how often have you found you could not cope with all the things you had to do? In the last month, how often have you been able to control irritations in your life? In the last month, how often have you felt you were on top of things? In the last month, how often have you been angered because of things that happened that were outside of your control? In the last month, how often have you felt difficulties were piling up so high that you could not overcome them? Okay, so from that, we can give you a score. Let's see. Okay, so there we go. All right. And now we have the Ardell Wellness Stress Test. Don Ardell developed a stress assessment that is unique in its holistic approach to stress. The Ardell Wellness Stress Test incorporates physical, mental, emotional, spiritual, and social aspects of health for a balanced assessment. Rate your satisfaction with each of the following items by using this scale. +3 is ecstatic, +2 very happy, +1 mildly happy, 0 indifferent, -1 mildly disappointed, -2 very disappointed, or -3 completely dismayed. Now from here, you can either give me a scale of +3 to -3. That may make it a little bit easier, so then we don't have to read off all the emotions. So from +3 being ecstatic, 0 being indifferent, and -3 being completely dismayed, how would you rate your satisfaction with your choice of career? Okay. Present job, business, or school. Marital status. Primary relationships. Capacity to have fun. Amount of fun experienced in the last month. Financial prospects. Current income level. Spirituality. Level of self-esteem. Prospects for having impact on those who know you and possibly others. Body, how it looks and performs. Home life. Life skills and knowledge of issues and facts unrelated to your job or profession. Learned stress management capacities. Nutritional knowledge, attitudes, and choices. Ability to recover from disappointment, hurts, setbacks, and tragedies. Confidence that you are currently, or will in the future be, reasonably close to your highest potential. Achievement of a rounded or balanced quality in your life. Sense that life for you is on an upward curve, getting better and fuller all the time. Level of participation in issues and concerns beyond your immediate interests. Choice whether to parent or not, and with the consequences or results of that choice. Role in some kind of network of friends, relatives, and or others about whom you care deeply and who reciprocate that commitment to you. Emotional acceptance of the inescapable reality of aging. Okay, so from there, then we can get a number. So that's going to take a little bit of math from me, so I'll have to do that when I have a little bit of scratch paper to work with. Okay. And now we have the stress coping resources inventory. People differ remarkably in their responses to potentially stressful events. For instance, about 1 in 10 hostages comes out of captivity a mentally healthier person than when entering, while the others may face extreme emotional difficulty. What are the factors associated with coping success? The questions below rate to factors most closely associated with the capacity to cope successfully with stress. And then we will be given 4 different choices that I will read to you, and you can tell me what most resembles how you feel. Number 1, how frequently do you moderately exercise? A, daily or more often. B, once or twice a week. C, once or twice a month. Or D, seldom. Okay. How often do you get a full, restful night of sleep? A, most every night. B, 4 to 5 times each week. C, 2 to 3 times each week. Or D, seldom. To what extent is your energy sufficient for your work and daily activities? A, to a very great extent. B, to some extent. C, to little extent. Or D, to very little extent. How closely does your weight approach the ideal level? A, my weight is at the ideal level. B, my weight is close to the ideal level. C, my weight is not close to the ideal level. D, I am dangerously overweight or underweight. To what extent do you eat a nutritious diet? A, to a very great extent. B, to some extent. C, to little extent. Or D, to very little extent. Okay. Which of the following best describes your use of tobacco? A, in no period of my life have I had the habit of smoking or chewing tobacco. B, early in my life, for a short period, I smoked or chewed tobacco. C, I stopped smoking or chewing tobacco over the past 2 years. Or D, I currently smoke or chew tobacco. Which of the following best describes your use of alcohol? A, I do not abuse alcohol and never have. Abuse is defined as drinking more than 2 drinks within a short period, such as an evening. B, very occasionally I abuse alcohol. C, I have a history of abusing alcohol, but am not presently using it. Or D, I am presently abusing alcohol. To what extent do you believe you have a history of coping well with highly stressful situations? A, to a very great extent. B, to a great extent. C, to a little extent. Or D, to a very little extent. How confident are you of being able to control your emotions in stressful situations? A, I never let my emotions run away with me. B, I seldom let my emotions run away with me. C, I sometimes let my emotions run away with me. Or D, I often let my emotions run away with me. When things are not going well, how likely are you to view the situation as being temporary rather than permanent? A, very likely. B, likely. C, unlikely. Or D, very unlikely. When something bad happens to you, how likely are you to exaggerate its importance? A, very unlikely. B, unlikely. C, likely. Or D, very likely. When stressed by a complex situation, how likely are you to focus your attention on those aspects of the situation that you can manage? A, very likely. B, likely. C, unlikely. Or D, very unlikely. When highly stressed, how capable are you of changing your thinking to calm down? A, very capable. B, capable. C, incapable. Or D, very incapable. When confronted with a stressful situation, how likely are you to wait passively for events to develop rather than take charge? A, very unlikely. B, unlikely. C, likely. Or D, very likely. Which of the following courses of action are you most likely to take when you have become thoroughly frustrated? A, identify an alternate goal and pursue it. B, pursue a relaxing activity. C, withdraw and feel sorry for yourself. Or D, vent your aggression on someone weaker than you. If you had worn an article of clothing one day and then found it to be flawed, how likely would you be to return it and ask for a refund? A, very unlikely. B, likely. C, unlikely. Or D, very unlikely. When an unexpected negative event happens to you, how likely are you to actively seek information about the event and how to cope with it? A, very unlikely. B, likely. C, unlikely. Or D, very unlikely. How much decision-making power do you have in your family? A, more power than any other member of my family. B, as much power as any other member of my family. C, less power than most members of my family. Or D, less power than any other member of my family. How much decision-making power do you have in your working environment? If not working outside the home at present, use your last job as a basis for answering this question. A, more power than most members of my work team. B, as much power as any other member of my work team. C, less power than most members of my work team. Or D, less power than any other member of my work team. To what extent do you believe that events in your life are merely the result of luck, fate, or chance? A, to very little extent. B, to little extent. C, to some extent. Or D, to a great extent. How easily do you make friends in a strange situation? A, very easily. B, easily. C, uneasily. Or D, very uneasily. When highly stressed, how likely are you to ask friends or relatives for help? A, very likely. B, likely, C, unlikely, or D, very unlikely? In comparison with other people, how likely are you to see others as threatening, uncooperative, or exploitive? A, highly unlikely, B, unlikely, C, likely, or D, highly likely? How often are you confused about the intentions of others toward you? A, very infrequently, B, infrequently, C, frequently, or D, very frequently? To what extent are you aware of practical, healthy ways of relaxing? A, to a very great extent, B, to some extent, C, to little extent, or D, to very little extent? How frequently do you pursue some highly relaxing practice? A, daily or more often, B, once or twice a week, C, once or twice a month, or D, seldom? How often do you engage in a spiritual practice such as prayer, meditation, or inspirational reading to enrich your interior life? A, daily or more often, B, once or twice a week, C, once or twice a month, or D, seldom? How connected do you feel to your conception of a higher power or a worthy cause? A, to a very great extent, B, to some extent, C, to little extent, or D, to very little extent? To what extent do you believe your life has purpose? A, to a very great extent, B, to some extent, C, to little extent, or D, to very little extent? How much contact do you have with what you would consider a spiritual community? A, very much, B, much, C, very little, or D, none? Okay. And that would be the end of our questions. So I'd like to thank you for your participation. Did you have any questions at all? Okay. Yeah, some of those questions were a little interesting, almost old-fashioned, wouldn't you think? Yeah, I think so. But I'm not the one who wrote up the questionnaire, so they are, for the most part, valid questions. Some of them just touch on things that are a little interesting, but that's how the questionnaire was written. So I'd like to thank you for your answers and your participation. Did you have any other comments or questions at all? Okay, so from here, I don't need anything else from you, and we will be contacting you about your scores and about what we found, and we may contact you for another study in the future if you should be interested, okay? If you don't wish to have any other participation in any studies, you can let me know and I will just jot that down. We'll still send you your information from this assessment. Okay, that's just fine. So do you have any questions for me at all? Anything about the program, the study? Okay, so I'd like to once again thank you for your answers, your honesty, your participation, and your patience. I hope you have a whale of a day, and a good rest of your night. Thank you. Bye now.